So whenever there is a hernia, we can do a laparoscopic repair or start the procedure laparoscopically, and if need be, you can convert it. So patients should be fit for a general anesthesia, then only we can do laparoscopy, because we have to inflate the abdominal wall, or if we are staying in the muscle wall, then we have to inflate that area. So for that we need to pump in carbon dioxide so as to create a working space for us. If we can't give general anesthesia, so this is not possible. So patients who are fit for anesthesia are always taken up for laparoscopy, and those unfit will go in for an open surgery.